Welcome to Ion Connecticut. I'm Mike Savino. Last summer, we saw a nationwide effort to try and dismantle systemic racism after George Floyd was killed by a Minneapolis police officer. And part of that push included calls for racism to be declared a public health crisis. This year, Senator Saud Anwar is attempting to do that here in Connecticut with a piece of legislation. And here to talk with us about that bill is Senator Anwar. Senator, thanks for joining me.
Thank you so much, Mike, for having me. Thank you.
So, just to start it off, what prompted you to put this bill in this year?
Well, there are a number of things that have been happening. One is, of course, the pandemic, which is critical. And that actually had reached a point that we had to intervene in an urgent manner because of the pattern of illness and the pattern of deaths that we had seen in our state. But as a physician who's been in Connecticut since 1995 and have been practicing in our state, this is something that all clinicians in our state actually see almost every single day, when we are seeing patterns of illnesses and the severity of illness being different in our different communities that we serve. And so we have all understood this. Myself, I have been studying this, being part of various groups to look at policy strategies. But it came to a point that we had to intervene and do in a very clear manner that we have a responsibility. So, of course, then with the George Floyd and that impact, it was just a perfect storm coming together for us to wake up as a community and stand up and do something about it.
And that was, I certainly wanted to ask, the flip side is that, you've seen this for a while. A lot of people have been talking about this for a while, that, maybe we should be taking a step like this. So it sounds like it's the pandemic. It's what happened with George Floyd last year and the protests over the summer. A lot of those things just brought this to the surface. Is that why we're seeing this now, as opposed, why there's momentum to do this now?
And yes, absolutely, for sure. And I can tell you, this was the first time as a legislator I can put bills in. So if I had the opportunity, I would have put in before as well.
And then, of course, being you won a special election in a year when real quick for people to understand the process, it's a 2-year term. The first year is a longer session when lawmakers can put in their own bills. You won a special election, which saw you only serving the second half of a term. The shorter session, which would be the second year, only committee bills can be raised. So this is your first year being able to raise bills. When we call something a public health crisis, we think of the pandemic. We think of something that is affecting everybody. But more generally, speaking as a doctor, speaking as a lawmaker, when you want to call something a public health crisis, what are you talking about?
Well, if there is a disproportionate number of deaths where people are unable to achieve their full lifespan, when the number of children with illnesses are multitude more, the infant mortality is 4 times higher in a community. If you look at, and the maternal mortality is much higher. So you look at the mother's death, children's death, the lifespan of the people, the cancer outcomes of a community being so different, then you actually start to say, you know what, this is a crisis. And this crisis is not getting better, it's actually getting worse. And the pandemic has shown that the number of deaths are exponentially different in our minority community, especially the Black and the brown communities.
And so what would be the purpose of declaring it a public health crisis beyond just being symbolic? Are there certain things that can happen once we do this?
Yes. So there are critical aspects. One is, of course, diagnosing the problem, but then treating it. Diagnosing alone won't do it. Just declaring alone does not get us anywhere. So yes, declaration is a starting point, but we need to have a strategy going forward, because this is a result of policies, historical policies that have been a part of our state for multitude of years, and that has resulted in us to get there. And these policies are around so many different components, which is around housing, about access to healthcare, about access to healthy living, about the air that people in certain parts of our state, what they are inhaling in their indoor housing environment, or even in the outdoor community where they live. You name it. You look at the criminal justice system, the access to some substances is different communities. All of those things are part of the web of causation that has led to, us to be where we are. So then we need a comprehensive strategy. But the way I would put it is that it was policies that have brought us to this point, and it will be policies that are going to get us out of where we are.
So this in and of itself, this wouldn't free up money or do anything, but in your mind, it kind of shifts the way we talk about this, that you hope then shifts how we make policy around these issues going forward.
So we have the good news is we have experts who have spent so many years of their life studying what is happening in Connecticut in different areas, and my bill is asking for a Truth and Reconciliation Commission. This commission is going to actually have a number of different people with different backgrounds who are going to be able to make recommendations on policies that the legislatively would have to be implemented. We are hoping that the executive branch would implement those policies, but we want to make sure that there's a legislation that is going to have it codified so that going forward, we have a strategy to undo what we have seen.
And of course, there are ideas out there now. I mean, there's several bills at the state level, for example, dealing with local zoning and trying to address segregation within a community. Obviously, reparations is always an idea that's out there and can be acted at a local or a state level even. Are there certain things you want to see, or are you waiting for this commission to propose ideas?
No, so right now we have a number of those bills that are actually already out there. So look, we have begun to understand the challenges and the rationales, what's going on. We also need to go deeper into the causation and deeper into the solutions. So the low-hanging, very easily understood aspects are that we have food deserts. It's almost very difficult to get food, healthy food in some of our communities, inner city communities. We know from data that a child's lifespan can be determined by a tobacco outlet from their school. We know that a child's BMI, their body mass index, how heavy they would be, is determined by the distance from their school to a fast food place. So we know from day one, some of our children are set up in a way they're going to be eating unhealthy and they're going to be inhaling unhealthy. And they're going to live less longer because of some of those aspects. The diabetes epidemic. Why is it that the sugary drinks are being marketed to the minorities much more? Why is it that the menthol cigarettes are being marketed exponentially more to the minority communities so that they actually get addicted? So when you look at all of those patterns, there's a very clear, and for those very reasons, we have started to have those bills come out to begin with. And then what we also need to look at is a strategy for a long-term plan where we start to gather this data even more in a more organized manner. We just need to have that strategy. So the low-hanging fruit bills are going to be there, and then we need to go deeper into this going forward.
We saw even here in Connecticut, local municipalities made similar declarations last year. We've seen pushes all over the country at the state level. There's even a bill before Congress. Are there models that you're looking at that you'd like to see happen in Connecticut based off of your bill?
So the part that's fascinating is that yes, there are parts of the country that are doing things right and in many aspects, but Connecticut has its own set of challenges. So we will have we can absolutely pull experience and data from other parts of the country and look at how people are trying to address this. This is a across the board United States issue as well. But Connecticut has in this region a much bigger problem than one would have expected, and it's heartbreaking when you see that we are a state which claims to be a progressive state, which claims to be ahead of the curve in many ways, but with respect to some of our steady habits of why we have not intervened for so long, it's pretty painful when you look at what we have not done, and that's why I feel that we will have to write our own book on this one.
Right. And you mentioned, of course, segregated housing. You touched on education. We continue to have one of the biggest achievement gaps in the country, despite our heralded school system. When we talk about this as a public health crisis, you bring up those other things. So do you see addressing housing and schooling, as you kind of mentioned, do you see those as solutions to what's being phrased as a public health crisis and the health outcomes that you're pointing to?
Yes, absolutely. They will play a very big role. And I know I see this now. I see this in a very clear manner where a person is born in our state, which place that they live in, they come to me in my office as a lung doctor, they can't breathe. And I cannot write a prescription to say you can't live in your home anymore. That is killing you. and the person is on steroids, has to be kept on medications forever because they are stuck in an environment. And that particular chance alone that has resulted in that individual being there is going to determine the remaining aspect of that child's capacity to educate. I have had these individuals who could not even go to school because they were unhealthy, and it was their home that was killing them. And there was no way for the family to be able to do much about that aspect. When you see that situation, you see that this is not an individual disease, this is this disease of our state.
And this bill is currently being lumped in with a larger Senate bill that is a top priority for Senate leadership. But, as we go through the process, we all know things can get changed, bills can die, pieces can get pulled out. And of course, this session presents its own complications with the pandemic, with a lot of the work being done remotely. And there's been an emphasis on trying to streamline things, keep things simplified, allow them to move quickly and smoothly because people aren't able to meet in person as they normally would. So if your proposal falls by the wayside this particular year, of course we can come back to it. But are you worried that, if we don't do this year, if we don't make this declaration this year, that momentum could fall off, people could get focused on other things or sort of lose, we're already almost a year removed from George Floyd's death. Are you worried about that energy behind something like this falling off?
Yes, Mike, my other big concern and my fear also is that we're going to lose more people to our poor planning as well. So every day we are not doing and acting and making a strategy, we are actually losing more children to health related issues. And also, look, we have had a 1 in 100-year event. And we have seen the worst number of deaths. 7,500 people have died in our state, and most of them are vulnerable individuals, either because of age or their race and their socioeconomic status. And if we cannot come together after such an event, I would be just disappointed in our state. But I can also tell you that it's not, interestingly, it's not an easy sell, and I'll tell you why I'm saying that. Because even today, right now, as we speak, there's a public hearing that's happening. And I hear some of my colleagues being in a state of denial. And they're in a state of denial that they say, well, it is the choice of the people which is resulting them to be able to live less longer. Why is it? And their mindset is somehow that people are doing it to themselves, and they don't even connect the dots with the policy to the action and the results that we're seeing. And that's painful for me, because if this doesn't wake them up, I don't know what will. But again, everybody needs a different level of education. So I remain committed to educating my colleagues, sharing them with the stories. I'm seeing it firsthand. I'm in the front line to be able to see it. And I also am interacting with the communities that have been impacted. So I look forward to hoping that people will do the right thing. If they don't, we have to save these lives. And it is a moral question, and this is a financial question. No part of the world outside of the United States would leave a quarter of their population to die early just because of what they look like, and then expect to be successful in what we manufacture, what we do, how we actually have an economy. And this is something for the people who are not willing to listen to the moral argument. I would say, look at the financial argument about this.
What do you make of that? I mean, you're proposing something that you see every day, that you feel like is just out there and plain to see. And yet, we continue to see arguments that no, this doesn't exist, or that, as you mentioned, it's being characterized as the choices of the people who are suffering this. I mean, what do you make of that?
It is. I want to use polite words, but it's very difficult to remain polite some of the times to be able to say this. But what I would just say is that either people have lived in their own reality for long enough that they have become completely blinded to the other individuals. There's a weakness in our society where we're losing empathy. How is it that we cannot understand and be able to understand the challenges that somebody else is facing? Why are we not humanizing our fellow humans? And that has become a very big issue. And then some people live with a mindset that, look, if it is not impacting the individual themselves or their family, it is not happening. And the policy making is not about whether you're doing well or not. It's about, is everybody else doing well? And I think that's where there's a disconnection. The other challenge that we have is our partisanship is malignant to the point that if somebody is going to say, if a Democrat is going to say, look, this is the way to do it, my Republican colleague will have no option but to just say, from the organized group, to say, you have to say no to this. And then, and as a knee-jerk reflex, they actually say no, no, and then they find a reason for it, and the reasons are not very bright. And then I'm seeing that pattern, and it's not healthy. And then hopefully we will evolve to be in a better place.
As we move forward with this bill, do you envision it focusing specifically on the issues you've highlighted, which disproportionately affect Black and Hispanic residents here in Connecticut and around the country? Or do you see this as possibly broadening to address all kinds of racism? I mean, you yourself, as a Muslim who's run for office, I know you've experienced it. We see what's happening to Asian Americans around the country. Of course, Jews continue to experience anti-Semitism here. Do you see this bill as addressing all of that, or do you think that if we get too broad, it will slow things down, and first we need to address those issues that you've highlighted in this conversation that affect Black and Hispanic residents?
So I'm looking at this exactly from the prism of health and outcomes. And I can tell you that the Black and brown communities are way ahead of the curve in this, but the Asian community is right behind them as well. And I can tell you from the emotional impact of anti-Semitism and what it does to our community is part of that effort as well. But I can also say that in this boat, our Black brothers and sisters are way ahead of others. And then right behind them are our Latino brothers and sisters. And then I think we have to put our resources and the limited effort of the resources where the policy impact is going to be the most, and we'll get the highest return if we start to invest in that arena. But we cannot leave anybody else behind. So the bill does not restrict anybody else in the picture. But I can tell you from the severity of the challenge problem, our Black and brown communities are ahead of everybody else in the negative impact of our policies.
Well, of course, this would be a huge change in how we talk about racism in Connecticut, which I guess is what you're trying to go for here. Senator, thank you so much for your time.
Thank you so much for this conversation. Thank you.